Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I had the pleasure of talking with Dr. William Li, who is an internationally renowned physician, scientist, and author of the New York Times bestseller, Eat to Beat Disease, The New Science of How Your Body Can Heal Itself. Today, we talked about ways your body learns to heal itself, foods that influence cancer, autoimmune disease, obesity, and weight gain, and the science around organic versus conventional food choices, and so much more. So stay tuned. Hello, everybody, and welcome to the Smart Human Podcast. Today, I have the pleasure of talking with Dr. William Li, who is an internationally renowned physician, scientist, and author of the New York Times bestseller, Eat to Beat Disease, The New Science of How Your Body Can Heal Itself. His groundbreaking research has led to the development of more than 30 new medical treatments that impact care for more than 70 diseases, including diabetes, blindness, and heart disease, and obesity. His TED Talk, Can We Eat to Starve Cancer?, has garnered more than 11 million views. He's appeared on a variety of TV networks, in print and media, authored more than 100 scientific papers, is on faculty at several of the top medical schools in the past across the country, including Harvard and Dartmouth. And he is also the president and medical director of the Angiogenesis Foundation and is a leading global initiatives director on food as medicine. His newest book, New York Times bestseller, Eat to Beat Your Diet, Burn Fat, Heal Your Metabolism, and Live Longer, was released in March. So thank you so much, Dr. Li, for being here. I got tongue-tied because I get a little nervous when I talk to people I respect and I'm excited about. So I apologize for that, blah, blah, blah. But thank you for being here and sharing your knowledge with this audience.
Well, thank you, Dr. Cohen. It's exciting to be here, and I love to actually share a lot of new information that's coming out about from my field of research.
Yeah, which is great. We're going to dive in, and hopefully, you'll give this audience kind of a great understanding of some really key points. I read your book, real cover to cover, actually at my son's lacrosse practice and beyond, as I was mentioning to you, and it was just spectacular. So let's just really start with something to, break the ice and get to know you a little better for our audience. Really your trajectory of your career, conventional medicine, you went to, I think, Harvard undergrad, and then was it Massachusetts General for residency in internal medicine beyond med school, I think was at University of Pittsburgh.
Yep, exactly.
Tell me a little bit how you got to this moment writing these books and sort of, focusing on many of the mechanisms of cellular repair, which we'll get into.
Like many doctors who are now just starting to refocus their attention towards health instead of focusing only on disease, which is really how we as physicians are trained, right? Mm-hmm. We don't have medical school courses on health. We've got medical courses on disease. Mm-hmm. And I think, the medical community is starting to shift, but I started my shift literally before I went to medical school. I was a biochemist as an undergrad, in a lab with test tubes and doing experiments at what we called biochemistry is now molecular biology. That's understanding how cells perform and act at a very, very complicated, deep level. But I have to say, after I finished my undergrad degree in that, but before I went to medical school, which is a long treadmill that we all have to get on, kind of like hamsters in a cage, going with the wheel going around and around, I actually did a gap year. And in my gap year, I went and I went to Italy and I went to Greece specifically to study how food and culture and health were related in the Mediterranean. So this was, I don't want to date myself, but this was long before people were talking about the Mediterranean diet. And so I was walking that walk because I was so curious. I'm somebody who grew up in a multicultural family. We loved food. I loved the idea that there were these long traditions of eating that were integrated into how people thought about what was valuable to their society and their culture. So I wanted to explore. So what did that mean? I mean, I grew up, in America, like probably many people watching this podcast, with the same junky foods, of fast foods, of, ultra processed foods, and it's all the stuff that's advertised on television. But I realized that there was a whole other world to explore in the local markets, seasonal, regional, with traditional recipes that dated back to grandmothers and their grandmothers and their grandmothers. And I wanted to see what that all meant. So I went to medical school, drinking from the same fire hydrant that every doctor does.
You like to say Kool-Aid, but we know that has a lot of
we're
chemicals.
Not drink Kool-Aid anymore. But I have to say, as I learned about diseases and drugs, and memorized all the stuff that, the encyclopedia, the books that we have to memorize just to get through medical school, something always stuck in the back of my head. So whenever the professors would say, and here's what you need to know about Alzheimer's disease and diabetes and chronic obesity and renal and kidney failure, I would periodically say, okay, professor, I get it. Like, I'm going to memorize it, promise you. You've told me about the disease, but I have a question. What is health? And the answer I would always get would be well, you know what health is. Health is just the absence of disease. If you don't have kidney failure, you've got a healthy kidney. If you don't have diabetes, you got a healthy metabolism. And I thought, wait a minute, that just can't be right. I never was happy with that answer. So I didn't let it go. So I dove into a field of research called angiogenesis. Angio is blood vessel. Genesis is how they grow. So how our body grows, our circulation was something I was very interested in because I knew inside our body, our circulation, our blood vessels are the highways and byways to every cell and every organ in our body. What we breathe gets transmitted through our blood vessels to our cells and organs. What we eat, the nutrients, as well as the pharmaceuticals that are injected or we swallow, are delivered through our blood vessels. So I was fascinated by how blood vessels are a common denominator of health and disease. And that's really propelled me at a very deep scientific level into thinking about health, thinking about how medicine is, of course, medicine. Pharmaceuticals are, of course, medicine. But it also got me thinking about how food is medicine because they're delivered the same way to our cells. And I think that because I started this nonprofit called the Angiogenesis Foundation, and we somehow, I know how, we wound up helping to coordinate the research and all the heavy lifting that it takes to develop new treatments for cancer, vision loss, wound healing. And we now, in your intro, you said, it's 30 some drugs. Like it's actually 44 at last count. We did this so well. I started realizing that maybe what I should be doing is taking a look at how we can actually intercept disease before it starts, before you need pharma. And so if you're talking about prevention, it's really difficult to talk about pharmaceuticals. So it's much better to talk about food as medicine. And so then I began to study foods and the chemicals inside, natural chemicals in foods, using the same systems that we've used for drug development. And so food is medicine. Like I always jokingly say, I'm one of the OGs when it comes to looking at instead of throwing drugs into the lab test tubes and systems and studying clinical trials, we can throw foods and have the same rigor to be able to look at what do these substances do and how do we know they work in people. So that's really how I got to where we are today.
Yeah, no, it's a great trajectory. And I think having that innate interest is really what keeps spurring you on, because some people just sort of flatline when it comes to education. You get to where you're supposed to be and then you're sort of, But for others, it's a lifelong journey. And I think that that's what kind of intrigued me about where, talking to you. I was reading your book, Eat to Beat Disease, and you really start off with a bang, a wallop. And you talk about the premise that we all have cancer growing in our body now. And can you explain that? Because I found that really a fascinating intro to your book.
Yeah, well, look, I'm a cancer researcher, among other things that I do. And like everyone who's watching this or listening to this, I started very fearful of the C word, right? Cancer is like the one word, whether you're a doctor or a patient or somebody across the dinner table, when you mention it, immediately sends this kind of sobering shiver down your spine. And it's the one disease you hope you never get. And if you have it, it's the one disease that you hope you're going to survive and you never want it again, right? Like it's a nightmare of a disease. And yet, here's what we actually know. And I hope that people who are listening to this, what I'm about to say will punch through a glass ceiling that modern research about cancer is leading us to understand, which is that cancer is not to be feared. We are now, even if you're diagnosed with cancer, being able to see the first signs that the medical community is able to reverse cancer from stage 4 to stage 0 in some cases. The idea that you could take metastatic cancer and, wind the clock back and put everything back in its spot is happening today. Very slowly, only in a few patients, but the future has already arrived when it comes to cancer. So one thing as a doctor, I always tell my patients, listen, where you are today, where we are today as a medical community is completely different than when I was in training. And yes, this is a significant disease, but we're starting to realize how we can actually conquer it. So you got to come on this ride with optimism. Okay, so that's one thing. And the optimism, by the way, comes from amplifying our own health defenses against cancer, which include our immune system, because immune therapies for cancer are the most natural way for us to conquer this dreaded disease. With immunotherapy, we're able to activate our body's own immune system, our own health defense system that searches out and destroys cancer all by itself anyway. We just make it work better. Okay, now I just use that as an intro, kind of as a little bit of a mic drop to tell you something that's really important to understand. Our body is composed of cells, human cells, right? Like we all know that. It's what we learned in medical school from day one. How many cells? We don't really have an accurate count, but let's round it up to say about 40 trillion cells. And these cells have to replace themselves every so often. But you can think about it, we have to copy and paste ourselves every single day. The reason that we're still here today and didn't go away yesterday is because our cells were able to copy and paste. And the reason we're going to be here tomorrow is that we're copying someplace in our body is copying itself today for tomorrow. All right. So imagine copy and pasting our cells is something our body does. Now, copy pasting is something that we're used to doing, right? So if I gave you, Dr. Cohen, a simple sentence on a Word document, and I asked you to copy it 10 times, you're going to, on your laptop, you're going to do it perfectly. All right. If I asked you to do it 10,000 times, you're going to make mistakes. As good a typist and as accurate as you are as a physician, you're going to make some mistakes because, nobody can do 10,000 things perfectly. Now imagine asking the body to copy 40 trillion cells perfectly every single day. It just doesn't happen. In fact, every time you make a mistake on a Word document, thankfully, we've got spell check that fixes that. So now we can actually fix those mistakes. Well, in the body, we do have spell checks. Our DNA, when the cells copy themselves and make mistakes, they're really errors of our DNA because our DNA is what needs to be copied in a cell. Those mistakes, every mistake has a potential of becoming a mutation. Our body, our DNA is a health defense that will fix those mistakes. We do have a natural spell checker in our body, but it's not perfect. And when it's not perfect, a few of those mutations stick around. And mutations in cells are what leads to cancer. So because our spell check isn't perfect, take a guess on how many, you probably have read this number, how many mistakes our body spell check misses every single day. In other words, how many mistakes in our DNA, how many mutations are made every day, every 24 hours?
I don't remember specific. If this was a board question, I'd be in trouble, right? Because it would be A, B, C, or D. Usually C.
But listen,
yeah.
I want everyone to remember this because it's a real number. Every day when our body copies itself, it makes 10,000 mistakes in the DNA. 10,000 mutations are made every day just to be alive. From the time we're born, day one. We come out, we get the spanking, we take our first breath, and then we're on our way to the rest of our lives. Every single day, our body makes 10,000 mistakes. That's 10,000 mutations that can turn into what we call microscopic cancers that live invisibly. Most of them will never, ever hurt us, in most of us, for the entire spectrum of our lives. All right. And the amazing thing is that every cancer patient I've ever taken care of, including my own mother, always asks the question when they get the diagnosis, the dreaded diagnosis, why did I get cancer? What happened? What did I do? What did I do wrong? There's something I did. And in obviously, as a doctor, that's a very important question to try to help a patient grapple with, right? Like you're not treating the disease, you're treating the person. So when they ask that question, it's so important to help them come to terms with, where they are. However, you and I are both doctors, and so now I'm sharing you with a better question to ask. The real question to ask is, given all these mutations, how come we don't have cancer more often? How come we don't regularly get childhood cancers? How come teenagers don't regularly get colon and lung and ovarian and uterine cancers? What helps us prevent getting cancers? Like, what is health and how come we don't get cancer? Well, it turns out that we do get these microscopic cancers all the time. And our body uses 5 health defense systems, which is what I write about in my book, Eat to Beat Disease. And I call it back again in my most recent book, Eat to Beat Your Diet. These health defenses are called into action, and they're basically like the 5 musketeers of defense to ward off, fend off diseases like cancer, but most other diseases as well, so that even though these mutations are around, they're not going to hurt us. Now, how do we know that microscopic cancers are forming all the time, right? So the question that somebody watching this might say, that sounds like you're giving me shocking information that we all have cancer in our bodies all the time. Prove it to me. Well, this has been studied. Autopsy studies done in England in women who died of traffic accidents and in other forms of premature death have found that women between the ages of 40 and 50, that 40% of them, when you look at the autopsy slices of tissue of the breast, 40% of women who don't have cancer, who are otherwise healthy, between the ages of 40% already have microscopic breast cancers. When you look under the microscope, you'll find them, but they're harmless. And for most of those women, that would have never turned into a breast cancer. In men, 50% of men between the ages of 50 and 60 already have microscopic prostate cancers when you look at autopsy studies. And most of those will not turn into active prostate cancers you need to worry about. So that was sort of like the reality check that we in the cancer research world have.
Right.
Doctors need to be taught this. Like, when we actually diagnose cancer, the horse has really been out of the barn for some time. And those little microscopic cancers, a few of them wound up going rogue and taking over our body. And so this is why prevention and food as medicine and all these other lifestyle things that we can do can keep those microscopic cancers in check. So if you're listening to this, you're interested in cancer and you want to prevent it, or if you're somebody who's dealing with cancer and want to know what can you do yourself to put that situation back into its box? It's all about our health defenses and the things that we are empowered to do ourselves. Doctors can't help you with this. This is stuff that's been left on the table for the last 100 years that we're beginning to come back and put it back on the table now that patients can actually do to raise our own shields against cancer and other diseases.
Yeah, I mean, the reason, and that's a beautiful explanation. I love how you're using these analogies, because I think for people, understanding how mistakes are made just by, it's an odds game, right? In terms of how many repetitions of anything, and whether or not that actually has any clinical bearing, or clinical meaning means it shows up with a symptom or it shows up at your doctor's office. Mm-hmm. So many things are under the radar. But what I loved about kind of starting with that premise was that, prevention and getting in there upstream, going to the upstream, instigators of these small cellular changes that cause our diseases, whether it's cancer or autoimmune disease in my world, you're going further and further back. You're going to the mechanism of how cancers are fed with angiogenesis and what are the blood, sources to feed them. And then even higher up on that, you're looking at the foods that really are magical and testable for their potency of preventing diseases, from basically expressing themselves from our genetics. So I just thought that was a really smart way to dive in. You talk a lot also about, you have your 5 mechanisms, which I thought was beautifully described. And, you also talk about stem cells. I'm going to break into a couple different discussions in your book. So stem cells are really interesting. These are the cells that become what we are, whether it's a cell or an organ or our whole body. Tell us a little about stem cells, and really what I'm also interested, amongst other things, is how do those stem cells get redirected with lifestyle and things that affect our life, be it air quality, be it stress, exercise, alcohol consumption?
Yeah.
So take it away.
Such a great and interesting question, because for most of us, hear about stem cells. Most of us, I'm a researcher, so I'm immersed in this world. But for most of us here, stem cells, if you've ever heard of it at all, you're thinking about, maybe you have a bad knee or tennis elbow, and you're going to go to the strip mall, and you're going to, pay a huge boatload of money to get an injection of stem cells. Well, look, here's the bottom line. I would discourage people from doing those, because stem cell therapy is really not ready for prime time for most diseases. There's a few, yes, but most not. And it's just kind of marketing, entrepreneurs trying to do something, based on a cool idea. But I want to kind of bring people to the beginning and tell you what a stem cell is and why it's important and how foods can actually activate it. So when we, we're all made of stem cells. We started as stem cells. In fact, when your dad's sperm met your mom's egg, and we were all just a bunch of primitive cells, forming our future body, our future us.
Right.
Everything was a stem cell. So the first things that got formed were your circulation, these little lakes of blood that had to lay down the patterns that, then turn into the organs. And then the organs were fed by the blood. And then you got later on bones and skin and muscle and everything else that forms. That's stem cells. And it's called stem, like the stem of a flower, because that's where the blooms start from. So you have a stem of a flower, there's little branches that can turn into different kinds of flowers. And that's exactly what these stem cells do. They start off all the same. And later on, if they're in your skull, they can turn into a brain. If they're on your skin, they can turn into a skin or a hair follicle to grow hair. If they're on your toe, they can turn into a toenail. Amazing, wonderful thing about stem cells is they can become anything. They're sort of masters of adaptation to wherever they need to be. So now how else do we know about stem cells that people might have heard about? If you've ever have been a parent and you're getting ready for your first child or, your delivery, you always get sent this note by your obstetrician to say, hey, do you want to save your kid's stem cells, your umbilical stem cells? Aha, that's the other place you hear it, but people tend to hear about it. So what are those things? Well, those stem cells are when the baby is born, you got to cut the umbilical cord. By the time of birth, all the stem cells have turned into whatever the baby has all the organs and cells it needs. It's all done. At least it's baked, ready to come out of the oven. But there's more stem cells that are needed than to create the baby. So where are some of those stem cells? Well, first, there are some stem cells that are left in the umbilical cord. So when we cut the umbilical cord, we're separating the mom from the baby, and there's still some stem cells in this umbilical cord. So what we do, we're able to squeeze them out, kind of like toothpaste out of a tube. When you get to the end of the toothpaste, you want to get that one little extra thing of toothpaste out.
Wonder if they have a plastic twister for the placenta. I mean, for the cord.
Yeah, exactly. That'd be a great idea. Well, there is a windy thing that you can actually use.
I bet.
And you squeeze out literally billions of stem cells and save them. Now, those stem cells, people go, well, the doctor told me that's really to help treat my kid if they have leukemia later on. And it's scary, and sometimes it creates a bad feeling. Actually, here's the deal.
I thought it's leukemia for the other children. Like you can't actually use the stem cells for the same child if it was leukemia.
Actually,
you can?
Yeah, you can.
Oh, okay. Okay.
And by the way, you can use it for other family members as well, potentially. So we're going to a pretty sophisticated point in using the stem cells. But the reason that they have to market about leukemia and cancer is because that's what the FDA is approved of. Now, the people who are doing research are saying, you should bank these stem cells because they're more likely to be useful to the aging you later in your life to grow a new liver or a spinal cord, or maybe even help to regenerate your brain. That's how fast this is going. But maybe that's a topic for another whole other.
I'll have you back. We'll talk about that too.
We can talk about regenerative medicine and how we are truly getting to a point where we can regenerate things unbelievably. Like you can regenerate spinal cord now, which is was unthinkable 10 years ago. Okay.
Right.
But what happens is that you cut the cord, baby's born, and there are still extra stem cells in the baby. Now, where do those stem cells wind up going? They get stored in these little secret compartments. The bone marrow, the hollow parts of inside your bone, stem cells live there like bees in a beehive, waiting to come out if they're needed. They also go into your liver, they go into your lungs, they go into your skin. They're hiding all these places. And these stem cells wind up rejuvenating and replacing old and damaged cells in our body throughout our children, our lives as children, but also through adulthood, even into aging. Invisibly, we are repaired and replaced and regenerated and renewed from the inside out by these stem cells. So how do they come out? Why do they come out? Well, whenever you have an injury, if you cut yourself, scrape your knee, fall off a bicycle, all right, that injury says, oh, we need a covering, so you heal from the outside. The wound heals up to grow more skin. But more importantly, we now know some of those stem cells are attracted by these signals from the damaged area to say, hey, come on out, we need you now. And the stem cells fly out of the bone marrow like bees in a beehive, flying out towards a flower bed, and they just start to regrow the tissue from inside your wound. And naturally, some of our organs are replaced as well, like our liver. This is something I learned in medical school because I went to the University of Pittsburgh where they invented liver transplantation.
Yes,
so
that is true.
If you remove 2/3 of a healthy adult liver and you leave only 1/3, the right 1/3 behind, amazingly, over the course of a couple of years, the rest of the liver will grow back. And I didn't know this, but if you clip off the top of your lung, the apex of your lung, all right, guess what? The tip will grow right back because we've got enough stem cells. And we do know stem cells also work because our hair grows back, right? We know that our skin grows back as well. And our gut lining also grows back. It's one of the fastest replacing, rejuvenating, regenerating cells out there. So here's the deal. We regenerate our cells with our stem cells that we inherited from the time we were born. And the new, really exciting research that I write about in Need-to-Be Disease is that these stem cells can be enhanced with foods like dark chocolate. Plant-based food, cacao, actually has the right polyphenols, proanthocyanidins. I'm a researcher, so I know exactly what it is, that can call out double the number of stem cells to help heal your circulation, your heart, your brain. It's quite amazing that this can happen. The other thing, by the way, you know this guy that's on social media, Dr. Ids? Have you seen his?
No.
He's this British doctor who goes out and comments on other people's food as medicine and health claims on social media. And he takes people to school and then teaches them what the right thing is. When I talked about on a podcast about chocolate, dark chocolate, mobilizing stem cells and doubling the number of stem cells and regenerating vascular function, blood flow, blood supply, benefiting people with heart disease. And he came on, he completely read the paper. And when he took people to school, he's like, yeah, Dr. Lee's actually right. This is super exciting stuff and you need to know about it. So this is the tip of the spear. Foods like dark chocolate, olive oil, pomegranates, barley, some whole grains, kiwi, they all can actually play a role in helping our body regenerate. And this research of which foods can stimulate regeneration is really, really important. By the way, you said a little earlier, what are some things that can stun or damage our stem cells? Alcohol. You drink a lot, you smoke a lot, cigarettes, vaping, you're going to be stunning your stem cells. That's like basically taking, brass knuckles and knocking out your stem cells. Why would you want to do that? So now we're realizing also that this is one of the reasons why excessive drinking and smoking, not getting enough sleep, chronic sleep deprivation also stuns our stem cells. Artificial sweeteners will also do it. Artificial preservatives, colorings, flavorings, some of them will stun our stem cells. So look, my world as a food as medicine researcher is to try to bring some explanation and clarity and specificity of why it is that we're now beginning to say, stay away if you can from eating too many ultra processed foods. Stay away from these chemicals in your environment because what now we know, among many things they can do, they can stun your stem cells.
And they can stun your DNA.
And
because
and
from
your
the
DNA
and your DNA, which obviously make up stem cells as well, right?
Oh, yeah. And even worse, so things in your environment, excess ultraviolet radiation, off-gassing for furniture,
Right.
great new car smell that everyone loves.
Yes.
And it's just fumes from chemicals going into your lungs. The plastic that you nuke in the microwave that gets into your food, the microplastic from the water bottles that we're drinking, or the tea bags that are coming off into the tea that we're brewing, all those things damage our health defenses. And here's the thing. Remember that spell checker we were talking about a few moments ago? That spell checker in our body that fixes errors in our DNA to lower the chances that we're getting microscopic cancers. These environmental assaults also damage our spell checker, making it more likely we're going to develop more microscopic cancer, making it more likely we'll develop cancer later on. Explanation, right? We'd be now beginning to understand why.
I love it. I love that you go to mechanisms. It made me a smarter person understanding them in your language. Because I talk a lot about this with the work I do in environmental health, but to hear it from your perspective, having your background in biochemistry, I think is very, very helpful. So moving from sort of the cellular level of disease, let's move more into the sort of a clinical picture. So, I have a lot of autoimmune patients. I have obviously cancer patients. I have a variety of everything, right? Of everything that everyone has, including myself, my family, and beyond. And we talk about, as you just mentioned, removing chemicals and sort of eating the foods that support us. But I want to kind of ask about a word that's gotten a lot of attention, which is inflammation, which tends to be more of a descriptive of clinical medicine. And almost everyone who's listening, I'm sure, and doctors, of course, we all speak that same language. We can understand the word inflammation, and we believe it's not good. And I believe that inflammation is not good, but there is some inflammatory processes that we know are good, and they're protective. So I wanted to, kind of balance that out. I'm not saying all inflammation is good, but just are there components of our immune system that clinically are relevant, that help us heal? And what are the foods and practical suggestions for helping that inflammation balance, that homeostasis that we're really trying to, achieve?
Fantastic question. And look, to have somebody with your background, Dr. Cohen, a rheumatologist that studies inflammatory diseases and treats inflammatory diseases, say that some forms of inflammation are actually beneficial, I think sends that message, because your world is really all about taming inflammation getting back to the balance that we actually need to be healthy. Okay, so I'll give you my vantage on inflammation and why it's important. And because I think a lot of the things that we see clinically and what we experience as patients ourselves is we tend to experience the extreme, and the terms that we tend to associate are with extremes. And this is where I think that, I'd like to maybe take out my hammer and smash a couple of myths. So everyone hears that inflammation is bad, must crush inflammation, and not true. Okay. Inflammation is one process that our immune system actually controls. Our immune system is very complicated. I always say our immune system is kind of like an army of super soldiers, of special forces, and the different cells all are trained to use their own weapons to do their own thing. And inflammation is one of those acts or processes that part of our immune system plays a role in for health. So you're like, wait a minute, inflammation and health? Why is that? Well, look, inflammation is necessary because what inflammatory cells do is they're called into action. Special forces, those special forces go into action whenever you have something like injury. You cut yourself, have surgery, you injure yourself in some way, a dirty wound, okay? The body's reflex is to send a few of these special forces, inflammatory cells, to that area to check it out, and with the idea that there might be bacteria there. And what they do is they light on fire this process called inflammation to burn out and destroy harmful bugs. And by the way, that fire that it lights is also a signal for healing that tissue as well. Mother Nature is really clever. So the same fire that burns out the bad guys is designed to trigger all the healthy cells to actually finish healing. right? Now, I can tell you this because I also, in addition to cancer research, I also study wound healing. In wound healing, you cut yourself, within the first few minutes, seconds to minutes, you get an inflammatory response. You ever cut yourself and you see the first thing that happens, even if you're not bleeding, is you get this like pink swollen area around wherever you cut yourself. And it's a little painful, but it swells. And that's inflammatory cells coming there, dumping all those signals, cytokines to bring in that fluid. It's killing any dirt and removing any dirt, bacteria. It's gobbling all the bad stuff away. And then naturally, over the course of, let's say, the first 2 days, 3 days, inflammation will go, all right, we got everything cleaned up. Time to, go back to the shop. And so all the inflammatory cells go away. Inflammation goes back down. Wound is cleaned up. The fire's triggered the healing process. And that's basically what happens inside and out of our body. That's why inflammation is a good thing. By the way, it's the fall and you're sitting on an airplane. Let's say you decide not to wear a mask in today's world and somebody next to you's got a cough. You're breathing in some of their germs. All right. And I'm deliberately not using trigger words. Okay. But you're breathing in germs and those germs are going to go into your lungs. You know what our lungs do? They mount inflammation.
Correct.
Right? Our body senses that, send the same special forces out. They see the same thing. They cause the same swelling. That's why when you get a cold or, you start to cough, you get a little congested, a little runny nose. That's all these little things, the inflammation is going on. So good until it's bad. All right. When it's bad, the inflammation doesn't stop. It doesn't go away after 48 to 72 hours. It just sticks around. Okay. Right. And instead of allowing healing to go on, because, it's like the cops that actually go back to the station, everything is calm in the neighborhood. The cops are out there and now they're busting out the boom boxes and having a riot themselves. Now you wind up having a problem. And I'll give people when inflammation doesn't go away, it's that fire that continues to burn. And the best analogy I'll give you is that think about inflammation like it's fire, right? So imagine you're camping and you're out there with your friends and you have dinner and then you're going to make a campfire and you're going to, warm yourself around the campfire. You're going to, toast marshmallows or, drink hot chocolate, whatever you're going to do, dark chocolate. And I would use natural marshmallows and not to eat any of them, definitely dark chocolate. All right. But what do you do at the end of the evening, right? That's inflammation in your fireplace. It's all contained right in that area. You're warming yourself. It's serving a really important role. And when you're going to go to bed, you put the fire out. All right. And then you go back into your tent and then in the morning you start it all over again if you need to. All right. That's normal inflammation. You start it and it goes away. Chronic inflammation is like that fire you don't put out. You go back into the tent anyway. And now wind comes and blows the embers out of your fire pit into the forest. And now the forest is catching on fire. And first it's a brush fire and then it starts burning the trees. And now you've created a massive forest fire. Right. That can't be put out easily. It's not going to go out by itself. And now it's even threatening you sleeping in the tent. That's the analogy of chronic inflammation. It's the fire that jumped out of the fire pit that didn't get put out naturally and wound up actually going and spreading all around and creating a threat to the body. And that's what we see in diseases like chronic inflammatory diseases. You see this in lupus. You see this in rheumatoid arthritis. And by the way, you see this in cancer as well. Cancer stokes that fire, or if you have that fire, it'll trigger cancer to grow even faster. So that's really the explanation of why we hear about inflammation being something that needs to be tamed. But we should all know it's intended to be healthy, just a short amount of it, and our body should usually tame itself. So what can we actually do besides taking steroids and taking non-inflammatory, non-steroidal anti-inflammatories, all the medical stuff that we write prescriptions for? I can tell you simply, many foods contain anti-inflammatory benefits, simplest one being vitamin C, ascorbic acid. And foods that contain vitamin C, they are really good at lowering inflammation. What are some of those foods? Strawberries, tomatoes, red bell peppers, broccoli, all great foods that are good for so many other reasons. They have anti-inflammatory benefits. And in fact, there was a study that I cite in my book in Japan. There's a Miyagi prefecture. There's a lot of women who have lupus and they have really bad lupus flares. And there was a study done to show that women who ate more vitamin C containing foods, strawberries, tomatoes, red bell peppers, broccoli, there's so many other ones as well. You can look them up. Okay. This is the amazing thing about, the internet. one of the good things about the internet, vitamin C, foods, inflammation, clinical study, boom, hit return, and you'll find resources that'll be put right to your fingertips, just like mine. All right. They show women who ate more vitamin C containing foods had lower levels of inflammatory markers in their blood, and they also had less and less severe flares of their lupus as well. Right. So we know what works. And these are decisions that we can actually make.
Yeah, I love that in the book that you also called out a lot of different specifics that I think really, help people who are reading identify your message with them, specifically. I love the vitamin C information. I think you also talked about rheumatoid arthritis, being an inflammatory condition. You talk about cancers. You talk about men and lycopene. I love the lycopene. I that was in your TED Talk as well. I had heard that study years ago, and it was so powerful to me because I thought, well, everyone should have at least half a cup of, tomato sauce every day. I mean, it's not a tomato. You're talking hundreds of tomatoes, cooked down, maintain all of their structural benefits from the lycopene. In other words, you don't degrade the actual lycopene. In fact, the more you cook it, if I understand correctly, the more the lycopene's released from tomatoes. So tell us about lycopene and the studies surrounding lycopene, because that's food as medicine as clear as day.
Yeah. Well, look, so I'm a researcher. I do cancer research. I do wound healing research. So I have the tools to be able to actually take a look at how things work and how they're influenced by food, as well as drugs. What are the things that actually lead to the benefit that we actually want in our body? That's how it's important to understand how food as medicine research is actually conducted. I teach an online course, by the way, called the Eat to Beat Disease course that actually reveals exactly how food as medicine research is actually conducted. Because I think it's important to understand, how do you get this information anyway? Well, here's the study that you were just referring to. It was a study that linked together the insights from a lot of research. The clinical study, well, researchers of tomatoes have found that there's a carotenoid. It's a natural substance found in tomatoes. One of them is called lycopene. And lycopene from a tomato that you pick off the vine and just eat in a fresh garden salad, it's got great vitamin C. It's got lots of fluid, hydration. It's even got some dietary fiber and other goodies in there that activate our body's health defenses. But the lycopene is really interesting because you get good lycopene off the vine. But when you eat it, the body absorbs maybe 20%, 20 to 30% of it. It's in a chemical structure that your body can recognize, but not all of it gets absorbed. However, when you heat up that lycopene, you change naturally that chemical structure into a shape, because natural chemicals all have shapes that actually your body loves to absorb. So you can go from 20% of absorption to 80% absorption and get the more benefit out of the lycopene that you're eating per tomato. Now, when you cook tomatoes, nobody cooks one tomato. You cook a bunch of tomatoes together into tomato sauce. So cooking cooked tomatoes gives you a lot more lycopene and a lot more lycopene in the form, because of the heat, that your body loves to absorb. One little other practical tip. Lycopene, to a scientist, when we look at the chemistry of lycopene, is fat soluble, meaning it likes to dissolve in oil. So what's the best way to heat up tomatoes? A little bit of extra virgin olive oil. That's the best way to heat tomatoes so you get the lycopene in the right position. But guess what? The olive oil also has polyphenols that are good for your health defenses. One of them is called hydroxytyrosine. I always tell people, don't worry about memorizing the complicated chemical terms I'm telling you. All you need to remember is extra virgin olive oil and tomatoes, put them together, heat them up. How much do you need to have? Food doses becomes important as well. Well, so that jumps into the clinical study that you're discussing. So there is an amazing research study that's been going on for almost 30 years now. It's called the Health Professional Follow-Up Study. About 30,000 people, mostly men, who've been studied over decades to see how they eat and how they live their lives affects whether they develop diseases or not. And as a big surprise that was found in this 30,000 person study was that men who ate 2 to 3 cups of cooked tomatoes, i.e. tomato sauce, each week, and that the amount was a half a cup only. You could eat more is better, but all you needed was half a cup, all right, had a 29% lower risk, almost 30% lower risk of developing prostate cancer. Now, why could that be? Tomatoes lower the risk of prostate cancer. Well, it turns out lycopene does some amazing things. Lycopene cuts off the blood supply that would feed a prostate cancer. Cancers also need a blood supply to grow. And there's many of these natural substances in food is medicine, that can starve cancer by cutting off the blood supply. That's what I talk about in my book, Eat to Beat Disease, but also I talk about it in my TED Talk. And we're doing even more work now that I'm teaching in my course about the latest foods that can actually improve your blood vessel health. It's a really cool concept. And by the way, olive oil can also have the same similar beneficial effect. Olive oil, tomatoes, now you're getting a double whammy of goodness. So the dose is important because I always wondered, all right, so tomatoes are good. How much do I need to eat? Well, only half a cup of cooked tomatoes is a really great thing. By the way, the study shows that even if you actually use canned tomatoes, it's still good. You still get that lycopene. Now, let me tell you one more thing about tomatoes that's new, because I wrote about this in my second book, Eat to Beat Your Diet, which is really about metabolism. And this is another thing that can help you lower the risk of cancer and other chronic diseases, including inflammatory diseases, and also lower the severity of inflammatory diseases like rheumatoid arthritis. And that is, tomatoes can also lower body fat, harmful visceral body fat, by improving your metabolism. How does it do this? Well, it turns out this, Mother Nature is super smart. And what she did is Mother Nature said, well, I'm going to make lycopene and these other natural food chemicals perform lots of job functions. So if you can starve cancer, let's also make it fight body fat to improve metabolism. So how does it do this? Well, think about it. I just told you lycopene loves to dissolve in oil and fat. So when you eat a tomato and you have lycopene in it, the first thing it does is, goes down you chew it up and it goes down your gut. Whether it's tomato sauce or a fresh garden tomato, tumbles down to your stomach and it gets into your intestines and lycopene gets absorbed into your bloodstream. You know where it goes? The lycopene goes after it's in your bloodstream. It makes a beeline, like a homing missile, into your body fat. All right. And what does lycopene do to your body fat? Guess what it does? It starts to trigger your body fat to burn itself down. And so, and specifically your visceral fat. Now, there's another study that was studied in Portugal. So a group at the University of Porto in Portugal studied young women with normal body types. So they weren't looking for super obese people or super skinny people, ordinary people, students, young college, women in college and also in grad school. And they enrolled them in this clinical study to look at the amount of body fat they had. Body fat, like inflammation, you need some of it. It's really healthy, important for you. It's just that a lot of it can be harmful.
Right.
And so they wanted to study what was the effect of tomato and lycopene. So here's the thing, there's an amazing study. They gave half of these only one ripe tomato to eat an hour before lunch every day. That's it. No special diet, no special exercise, no trainer, no gym membership. That's it. What's the power of one tomato in your body fat? And they found that if they did this for 1 month, a single tomato before lunch for an hour, that over the course of a month, the women would lose 2 pounds only on the basis of the tomato with no extra exercise, just normal daily activities. And the lycopene actually acted on their visceral fat, which is the fat that's found inside the tube of your body. It's the harmful stuff that wraps around your organs that can trigger inflammation. Too much fat causes inflammation in your body, and their inflammatory markers were also lower, okay, which is really good for inflammatory diseases like arthritis. Right. And it was just one tomato. And so this is the power we can, by the way, tomatoes also when you're eating it, because look, I like to cook. I'm I told you,
you're a foodie.
I'm a foodie and I love to cook. Yeah. I have to say, one of the things that we need to do better in medical training is we need to teach doctors how to cook, because if you can't walk the walk, you can't talk the talk.
I saw that. So that was one of my later questions was, getting riled up about, med school education. And, here you are even part of some faculty of med schools. And I've asked med school deans about that. I mean, I don't want to get off topic too much because I have more questions for you. But that was a real, since we're talking about cooking, you said avant-garde med schools in the book. And I thought, God, when is it not going to be avant-garde? When is integrative medicine or prevention going to be the staple or a large proportion of the curricula in med schools instead of a club where I've spoken at or, a secondary, interest group? even in 2023. I mean, it's just really sort of shocking.
Yeah.
So,
Well, but listen, we're having a conversation today that's based on serious research. It may be sort of the details that fill in the gaps of what we're hearing already. Eat plant-based foods, exercise, get enough sleep, lower your stress. All these things that used to be in the medical community just cast aside as like kind of BS. Let a therapist deal with it, or yoga. Who cares? It doesn't do anything. We know. I mean, look, if you're serious about healing and treating your patients, you got to learn this stuff. And my optimism is that the young generation of people in medical school right now, these are the future doctors. I mean, think about it. Every June or every July, there's a new fresh crop of new people that are going to be the future doctor. Right now, we're still dealing with a lot of, crusty old people from the Stone Age, right? So times are changing, but, you talk about integrative medicine as if, we have to use that term now as if it's a specialty, special skill. Every kind of medicine, every good doctor should naturally be integrative anyway. And in fact, in the future, I would say that if you are not, as a doctor, if a future doctor is not integrating everything they know with disease, health and disease, with food and drugs, if you're not integrating all that stuff and you're only focusing on pharmaceuticals, then those people in the future are going to be the alternative medicine doctors. They've just chosen to forget about the important stuff.
Just flipped.
Yeah.
I know. I mean, this is the hopes of so many people who understand and get it, that you can feed your way into health. You can feed yourself out of disease. And I'll lop in the chemical exposure component because that's sort of, my angle. I always say, all of these foods are incredible and they have science behind them. But I guess another question I have for you would be, for my own personal experiences, how much do you weigh in organic or, it could be a hot button. You don't have to answer. We can even edit it out. But I'm just saying, I'm very curious because I am so supportive of the food, macros, how to eat, which diet, what you've described, what your research is. But how much does the exposure of the chemicals of those foods, how they're grown, how they're packaged, what the water contamination may or may not be that they're grown in, or even drinking water, how much does that weigh in on your messaging?
Okay. So let me just kind of level set to say, and this is not triggering for me. This is all good.
Good. I don't want to trigger you. I don't. Not my guest.
I'm hoping to trigger people's attention to this because it's based on research. So I'm throwing myself under the bus here. Years ago, when the organic movement was first taking off, I was a real skeptic. And in fact, I felt a little offended, to be honest with you, because why would I want to pay more money to have less chemicals on food that comes from Mother Nature? It just seemed wrong to me. Yeah, they were more beautifully packaged, and they all looked a little bit better, but maybe some of that's the marketing and the care that was taken for it. And somehow it just didn't strike me the right way. Mm-hmm. So I kind of rebelled against organics, but I can tell you, I've changed my mind based on more recent research. Here's what we now know by the way, let me tell you. So the other thing that used to piss me off is that I have to pay more money so that I would have less harmful chemicals that were used to treat my food. Why would I want to pay more for less chemical that I didn't want to begin with, right? It was just offensive to me. Well, look, here's what we're now, and it's true, organically grown foods. It's not just the one with the labels, but any farmer who grows in the spirit of organic. And so I think that's important because there's a lot of ways that, that organic seal costs money and a lot of farmers can't afford it. And so especially small farmers. So if you actually grow in the manner of organic, you'll get the same effect and the food is just good. So it is true that many of the pesticides that are sprayed onto foods are harmful to the body and are difficult to get rid of. And this was a study by the USDA, by the way. You take a food like an apple where you might want to eat the skin, or peach or pear, stone fruit, plums, and you spray them with pesticides, all right? First of all, you cannot wash off. The pesticide actually penetrates about 20% of the pesticide sprayed on, penetrates the skin and stays inside the skin. You cannot wash that off no matter how long you're sticking the apple under the sink. And most of us don't spend that much time rinsing the apple to begin with, right? So this is stuff you can't wash off. Non-organic, I tell people to peel off the skin and don't eat it. If you want to eat the skin, which you should, because it's a great source of dietary fiber and polyphenols, you want to choose organic. So that's less bad stuff, all right? Number one. But I got a positive message for you on that too.
Oh, yeah.
So, and this like opened my mind to this completely. I was at a conference in London with botanists, okay, people that study plants. And this was right after a paper that was published in the journal Nature, which is one of the most prestigious, rigorous scientific journals out there. And they were talking about a natural polyphenol that's found in strawberries. Right? We talked about lycopene in tomatoes. Well, strawberries has something called ellagic acid. In fact, ellagic acid is what's make a nice strawberry tart. So strawberries are sweet. They're a little tart. And the tartness comes from ellagic acid. Well, ellagic acid is made by strawberries. It cuts off the blood supply to tumors. It's actually good for your metabolism, burns down harmful body fat, is antioxidant, protects your DNA, lowers inflammation, as well as vitamin C in the same strawberry, and activates your stem cells. So what's not to like about strawberries? You'd want as much ellagic acid as possible. Well, it turns out that ellagic acid was discovered by these researchers, and now this has been replicated in other foods as well, as the amount of ellagic acid in a strawberry is made in response to the strawberry plant becoming injured, damaged by insects, critters, nibbling on the leaves and stems. It's a wound healing response, all right? So the more bugs are nibbling on the leaves and the stems, which doesn't make a very attractive strawberry farm. You got to deal with all these little pests, but it makes the strawberries, naturally grown organic strawberries, loaded with ellagic acid, which is what you want. When you actually spray with pesticides conventionally grown, guess what? Fewer pests. In fact, almost no pests. No nibbling on the leaves and stems. No injury, and the plant makes very little ellagic acid. So organic plants are more in their natural state, subjected to the things that you get in nature, which are little insects and critters nibbling on the leaves and stems. No biggie. In fact, what it does is it stimulates the good stuff that we actually want in our body. Right. That's the reason to buy organic. You get more good stuff. True with organic strawberries, true with organic apples, true with organic coffee, by the way. You get a lot more chlorogenic acid in coffee. You get a lot more chlorogenic acid in apples. All right. And this is a theme that's playing out in modern food as medicine research. I'm willing to actually consider paying more, and the cost of organics going down as well, but I'm willing to pay more to get more good stuff as well.
I think it's I love that you looked at it that angle, because when I talk, I always say, okay, so pesticides that are on fruit are always they're going to affect your gut microbiome, and they're going to knock off those pests, those good bugs.
Yeah.
But what you're really describing is an evolutionary pattern of an organism trying to survive, and in the process creating something very synergistic for human health. And so when you take that exposure away to any degree, you're not just taking away the chemical itself that mechanistically will hurt your body, but you're taking away the actual innate benefits of that organism and how they evolved.
And think about organic, investing in organic as investing in health, because you're going to actually get more of those polyphenols that you actually want to actually get.
Yeah. And in terms of accessibility, I tell this all the time, and you can get frozen organics, which actually maintain all of their nutritional benefit because they're flash frozen. Yep. And so now you have big box stores across the country who saw this writing on the wall when I realized that they weren't allowing any organic produce in or frozens in. I'm like, what's going on here? And then, wouldn't you know it, big box stores created their own organic food lines that were frozen produce. And so, again, I think that whole myth of organic being inaccessible cost-wise, I mean, certainly in food deserts, yes. But from a cost perspective, I have to push back a little bit from what I do when I shop.
Yeah. No, listen. And by the way, I did some social media a few summers ago in the middle of the pandemic. I went on a cross-country trip in an RV, and I stopped, and I wanted to show people, a lot of the video I posted was, I could stop in a little tiny town in the middle of nowhere, and I could still find something. And often I would find organic food, including in the frozen section. And so, this whole mythology that you can't get good stuff. I even think that the whole concept of food deserts do exist.
Yes,
I think that even in a desert, you can find little pockets of water. And that's what people should be looking for. So where are you going to go get that that nourishing, refreshing stuff. Even in a food desert, there's almost no excuse I'm not looking for one.
Right. Yeah, it's a challenge. Don't get me wrong. I don't want to, because I'm in the Northeast here, as are you, but I do believe that there are ways to suss out places where you are and try to make the best of what you're offered. I know we're running out of time. I have so many questions. You have no idea how many I wanted to ask you today. Name some of the 100 foods that can enhance your body's ability to be healthy. I know we could break it into cancer and autoimmune, but, give us a take home of sort of, what everyone listening would have access to without, and I don't cook very much, which I know is not a good thing. But when I do cook, I cook a lot of the basics that anyone would be able to, access at any store. So just give us a couple of take home foods that you think we need to have in our pantry or in our home and use in our daily lives.
Yeah, well, look, people always ask me the same question, but they're even more specific. They say, Dr. Lee, tell me what you eat. What kind of diet do you follow? What are the top 10 foods that you want to have, you say that everyone should eat? And I come back to say, I'm not on a diet. I don't really believe in diets myself. I have many more than top 10 foods. In fact, in my first book, Eat to Beat Disease, I read about 200 plus foods. Yeah. In my second book, Eat to Beat Your Metabolism, I read about 100 different foods. So in total, about 300 different foods on food lists that I actually have. So I'm not going to go through all 300, but I have a simple way to communicate what I recommend. And then I will say a few foods, okay? So what I say is I'm not on a diet, given my knowledge of how I want to eat myself to be healthy and what I would share with your listeners or viewers, like what are the things you should do? I say I have a style, a pattern, a way of eating. And the easiest way for me to describe it in a way that people will remember, I call it my style of eating, Mediterranean style eating. Mediterranean style eating. And basically, I naturally gravitate towards the traditional foods that are found in the Mediterranean kitchens or in Asian kitchens. I say traditional because modern Mediterranean and modern Asian isn't always healthy. They've adopted a lot of unhealthy American patterns or Western patterns of eating as well, but traditional. So think about it. You go into the kitchens of or a restaurant, traditional restaurant in Italy, Spain, Greece, south of France. And what are you going to be finding there? You're going to be finding tomatoes. You're going to be finding Swiss chard. You're going to be finding garlic, red onions. You're going to be finding arugula. You're going to be finding basil, rosemary, thyme. The things that you can easily make a garden salad, or you can make a sauté, or you can make delicious dishes that, and by the way, this summer I was in the south of France doing research in the local food markets to see what was fresh in the summer. And I went on social media and I just taped myself, and people are going to see more of this. I'm going to be releasing more of my shopping with Dr. Lee in the Mediterranean market to see exactly what it is you buy. And so, you pick up an unusual eggplant, or you pick up a fresh jar of local honey fed on bees that fed off of lavender. What are actually in there? And how do you want you cook with it? Well, this is where when you have a mobile phone, you can type in a food. Okay, I'm just say Tuscan kale recipe and hit search. And then I hit video. And while I'm in the market, I can watch somebody who passionately shows me how to cook something that I might not have recognized. So you don't have to do all the same old things, but look for these, things in a Mediterranean kitchen. It changes by the season. And by the way, dried beans, people say, stay away from the middle aisle. Also a myth. So many good things in the middle aisle. Coffee beans, organic coffee beans, tea. Matcha is a particularly heavy in the powerful catechins that you actually want. Beans, dried beans, great for gut health. Very important for your gut microbiome. Incredibly important for lowering inflammation, especially if you want to prevent flares that are associated with chronic inflammatory rheumatic diseases like arthritis and other inflammatory diseases. Very important to be able to dark chocolate, cacao, 80% or higher, all found in the middle aisle. And also, by the way, found in Mediterranean recipes. So Mediterranean. Now on the Asian side, by the way, Mediterranean, not just Italy, Spain, Greece, France, but there are 20 some countries that ring the Mediterranean Ocean. Yeah. It is such a diverse group of places. Your hummus, all your different eggplant, the baba ganoushas. There's a lot of great foods that are absolutely delicious. The number one thing of any food that I eat, like I would say it's got to be tasty. The second number one thing it has to be is healthy, right?
Yeah.
And so now flip to Asia. You think about it. China, Japan, Thailand, Vietnam, like those are the foods that you naturally go to. Who couldn't find something on a menu in one of those restaurants that you might like? Now you go to those countries and you go to their markets, and what do you actually have? Cabbage, you have bok choy, you have ginger, you have bamboo shoots, you have juju berries, you have all kinds of fresh fruits and vegetables, horn melon, dragon fruit, papaya, all these foods that, you might have passed by in the grocery store. Now, give them a shot. And if you're not familiar with them, look them up online, look at recipe. Like you can look up the Wikipedia part of it for sure, but go right for the recipe and hit video and watch somebody with passion. It's like the Food Network. Teach how to actually cook with it. And you'll never be bored. Your palate will always be stimulated, and you'll never be afraid to try new things in a grocery store. That's how I do it.
Yeah. It's wonderful. It's exploring. I went to an Asian market around here, a supermarket, and, everyone was going in. I mean, there was just no specific person or country, it was so interesting because there were foods in that supermarket that were so different than down the street to our conventional big box ShopRite or Stop and Shop or what have you. And you just realize what you might be missing. Like you just realize what you might be missing. And it's very eye-opening to just even squid. There's living creatures in there.
Oh, yeah. Yeah. But here in the produce section, did you see something that I think is so unusual? I saw it in an Asian market the other day. They sell something you would have thrown away in a traditional supermarket, and it's the stem of lettuce.
Right.
So lettuce, right, is just you break off into a salad.
Or broccoli, you chop off the end, right?
So lettuce stems are called celtuce, CELTUCE. Mm-hmm. They are packed with polyphenols. And rather than just cut off the top of the lettuce, wrap it up in plastic and sell it with the microplastics that leach into it, they actually sell the actual stem of the lettuce. And that is actually a vegetable dish in Asia. You clean it up, you strip off the outer. It's a great source of dietary fiber and vitamins. And you cut them into medallions and you saute them with a little bit of garlic and ginger. And you got yourself a great vegetable accompaniment for your meal. So again, this is where it's wonderful to me. The way that I eat is really to please my palate while enhancing my health. My statement is always, love your food to love your health.
I love it. And I love that one of the most powerful sentences you have in the whole book, which I underlined and circled, the most powerful way to beat disease is to prevent it in the first place. I mean, if that didn't spring off the page to me, I think it's just such a wonderful thing. And everything, you're talking about, from your love of food to how to be practical about getting these nutrients into our bodies, to prevent these diseases that I think are really just epidemic now. I just think it's a wonderful, it's a wonderful conversation, and it's a wonderful contribution to the masses. So thank you so much for doing all of that work. I know we're running out of time. I have probably 10 more questions, which we're not going to get to, but I think we covered a lot. And maybe I'll have you come back in a year or something and we can talk about, your new projects and your new research. But I want to thank you so much for taking the time to chat with me, and sharing your vast knowledge. Where can people who are listening follow you, see you, read your books, and also, if you're practicing, in Boston, how can people reach you and see you?
Yeah, well, look, come to my website, Dr. William Li, Dr. William Li is spelled L-I, drwilliamli.com. You can follow me on social. My handle is at Dr. William Li, L-I. Okay. And I'm on TikTok, I'm on Instagram, all this kinds of. That's actually where I put a lot of new stuff up. I do a free newsletter of all the research that I've seen with some practical tips. Sign up. It's completely free. My mission is really to kind of get new information out to people. Having been involved with developing new biotech treatments for people, which takes like a decade
Yeah.
And then it's the stuff that only lives in the minds of doctors who choose to be educated on the latest treatments. I think the food as medicine world is completely different because something that we talk about today, we talked about tomatoes, we talked about tea, we talked about strawberries. Something new that you learn about food that's based on new research has immediacy. You can take, after watching this, the stuff that we just talked about and put it to work with your next meal. And so to me, sign up for my newsletter. I teach free master classes. I come on periodically. If you're ready to actually change your life and do a deep dive, I teach an online course called Eat to Beat Disease course, and I have a metabolism course as well. This is my way of actually having as big an impact as I can by helping people, listeners, viewers, to empower themselves. So if I can share a little bit of what I know in ways that you can put practice into your own lives to make your shopping and eating and choices better, that's what I really believe in.
And also, I loved your book, and I'm holding it up because I actually prepared and read this book cover to cover, and I thought it was excellent. So, and I don't do that all the time. So I will tell you that I really enjoyed it. It was a great read, and it really opened up my eyes a lot. So thank you again, Dr. Lee. I hope that we will see each other in the future and cross paths. But again, thank you for your time and for sharing all of what you know with our audience.
My pleasure. Thank you, Dr. Cohen.